So for today, I'm going to demonstrate to you on how to assess upper and lower extremities. But before doing the assessment, we need to perform proper hand hygiene. I'm going to use an alcohol hand-based wrap and then provide privacy to the patient. And last is to explain the assessment to the client. So first, we're going to inspect the ability of the patient to move her neck. So, ma'am,
Ask
one,
the patient to touch her chin to chest and to each shoulder,
three,
each ear to the corresponding shoulder,
4.
and then tip head back as far as possible.
So next is to inspect the upper extremities.
Observe for skin color, presence of lesion, rashes, and muscle mass. Then palpate for presence of lesions, rashes, and presence of masses.
So, ma'am, I want you to extend your arm and then rapidly turn up and down your palm. Okay, so and now, ma'am, I want you to flex your upper arm and I will resist an opposing force. Okay, 1. And now I'm going to palpate your elbow joint. And I'm gonna palpate your radial and brachial pulse. Okay. And now I want you to squeeze my 2 fingers as hard as you can. Okay. And now, ma'am, I want you to close your eyes and I have something to put in your hand and you need to identify the objects. So can you close your eyes, ma'am? Okay. So after, and I want you to close your eyes again, ma'am, and I will write down a number in your palm and you need to identify the number. Okay.
2.
Okay, in your left arm.
5.
Okay, that's correct.
Assist the patient to a supine position and examine the lower extremities. Inspect the legs and feet for color, lesions, varicosities, hair growth, nail growth, edema, and muscle mass. Test for pitting edema in the pretibial area by pressing fingers. If an indentation remains in the skin after the fingers have been lifted, pitting edema is present. Palpate for pulse and skin temperature at the posterior tibial, dorsalis pedis, and popliteal areas. Have the patient perform the straight leg test with one leg at a time. Ask the patient to move one leg laterally with the knee straight to test abduction and test adduction. Stroke the sole of the patient's foot with the end of a reflex hammer handle or other hard object such as K, and repeat on the other side. Ask the patient to dorsiflex and then plantar flex both feet against the opposing resistance. Observe the patient as she walks with a regular gait on the toes, on the heels, and then heel to toe. Perform the Rumberg test.
So, ma'am, I want you to stand and close your eyes for 20 seconds and move your arm inward. Okay. So observe of swaying of arms. So after the assessment is assist the patient to a comfortable position. So ma'am, have a seat, ma'am. and then perform proper hand hygiene. And then document the findings of the assessment.